And now back to Paris Schutz, who's co-anchoring tonight's show from Chicago's Bronzeville neighborhood on the South Side as part of our In Your Neighborhood series. Paris.
Yeah, Brandon, earlier today I spoke with Dr. Asim Saeed, who is the Chief Medical Officer of Insight Hospital, formerly Mercy Hospital here in Bronzeville. I began by asking him whether Insight was committed to its contractual pledge to keep Mercy a full-service inpatient and outpatient hospital until at least 2029.
Absolutely, and we pledge to continue to do it past 2029. That's our goal.
And, you know, there have been community groups for so long that have fought to keep this hospital open. The former owners said they just couldn't make it work. They were losing millions of dollars a month. How do you financially make this work and keep it a full-service hospital?
Sure, absolutely. That's a really good question. I mean, if you think about it, really it's just about being strategic and being efficient. There's been a lot of support from the state, from the community, from the city. And so, again, it's just about really just good management and being efficient and strategic in how we operate.
What are the things that you had to change to make it solvent?
Well, I think we're still in that process right now. As you know, that we kind of had limited access to the hospital, getting into the hospital. And so right now we're kind of using this time wisely to kind of go through everything, really kind of just the infrastructure and things like that to, really narrow down in on what can be improved and what we can make efficient to move forward with.
And tell me where you're at right now in terms of how many beds and what kind of services you're offering, and then where you hope to get.
Yeah, no, our goal is to get back to full capacity as soon as possible. That is a commitment that we've also made to the city and to the state and to the community. Right now, currently, our OR is back open. Our ICU is going to be opening next week. Our behavioral health unit is open to full capacity right now. Our general medicine beds are at lower capacity right now, but we anticipate for that to open back up once we get the ambulances back on.
And to the residents of the community that were very worried about this hospital closing, tell us, what services can they get here at this hospital right now?
Well, for right now, I mean, we do have the basic ER open right now. They're more than welcome to. We welcome them to come back to us if they need help or need care, or if they need attention or need just any sort of guidance. For the most part, right now, if a typical patient that comes in that has chest pain, we do have cardiology services here. A patient that would come in would need to get a chest pain rule out to make sure that their heart is okay. So we do have the basic services available. As we plan to add on more, then you'll start having more, comprehensive and advanced levels of care coming in.
And I think you know very well the concerns of community groups over the years. Why does Insight believe that this hospital is necessary for this community? I mean, you talk about you have University of Chicago a couple of miles away, other hospitals a few miles away. Why is this hospital essential here in Bronzeville?
Sure, absolutely. I mean, if you look at Bronzeville geographically, the way it's been divided up by the highways, it's almost like an island that's out here right next to downtown. So access to care is still very difficult. This hospital has been a community center that really has just been access of care for patients. So really, from an access point of view for this community, it's absolutely very, very important. Downright to the services like giving birth for children, for women's health, things like that. A lot of times having that access that's readily available to you is very important.
And Insight is still committed to charity care or a certain level of charity. It can do that and still remain solvent?
Absolutely, yeah.
Let me ask you about COVID as well. What are you forecasting in terms of COVID rates in this community and at the city at large, given that we've seen them go up?
Yeah, I mean, right now we're seeing that in the state of Illinois, the cases are starting to go up slowly. We are seeing that, states like California have reinstituted the mask policy. So initially we had planned that, usually by the fall time, as the flu season goes back up, that we're going to be prepared for that. But we are thinking that, in the next coming weeks, we probably may see something happen. Again, I don't want to speak.
In terms of a surge?
I wouldn't say surge, but I'd probably say, cases going up. Probably maybe reinstitution of the mask policy, but that's up to the Department of Public Health. I don't want to really go into too much into that, but we are being very mindful and watchful of that.
So we should mention residents here optimistic about Insight Hospital, although cautiously optimistic, because as you heard, they are not at full capacity. Only a few services, the OR and the ER, and some other services running now, as they said, slowly ramping up to get back to full capacity. As they said, their goal was, so residents will be watching that. And Brandis will wrap things up here in Bronzeville in just a bit, but now we toss it back to you.
All right, Paris, we'll see you in a little bit. Thanks.